welcome to Talkin' Tuesday. Today we are going to talk about KP, otherwise known as chicken skin, medically known as, I think it's Keratosis Pilaris or pilosis, not exactly sure, but a lot of people have been asking me about this just really recently, and I thought, hey, time for Talkin' Tuesday. And I don't exactly suffer from this myself, but apparently up to the 50% of the adult population and like 50 to 80% of the adolescent population gets this at some point in their life. So I want to tell you a little bit more about it just because it's something that I didn't know about, that I wanted to research and understand myself. And hopefully if you don't have it, you can learn a little bit more about it. And if you do have it, here's some ideas to help maybe treat it or why you have it or what to do about it. So first off, what exactly is it? What does it look like? It's called KP, otherwise known as Keratosis Pilaris or something like that. And what it is hardened keratin. We all know that our nails and our hair is made up of keratin. It's dead protein. It's just dead matter, dead protein, just like the skin that sloughs off. Well, KP usually happens right here on the arm. It's also known as sugar bumps or chicken skin. And a lot of people confuse it with acne. And it's these little bumps here that are kind of like just little hardened matter. They look like goosebumps, and you touch them, and apparently they're kind of like goosebumpy things. What they are is they're dead, hardened keratin. So the nails and the hair stuff is basically that in little teeny pockets on top of some people's skin. And it usually gets a little bit worse during the winter. Sometimes it can be itchy, sometimes it can get red and flaky and scratchy. But basically it's this goose-bumping looking, acne-like looking thing. Kind of looks like chicken skin, and it forms there, and that's kind of where it lives. And it can happen on other parts of the body too, generally here around the arms, but it could be other places as well. It is a genetic condition and it's chronic, so if you have it, you're probably going to have it for a while. It's not going to be like there for a week and then gone. It's going to be for months or years, and you can do things to make it better. The other thing is that it's usually genetic. If your parents had it, if your ancestors had it, usually that's how you're going to get it. It's not contagious. Sometimes it can be offset by the foods you eat. Some people, if they have eczema, they eat a certain food and they notice they break out more. Could be the same thing with KP. Depending on what you eat, your body will react differently to it. So that's basically kind of what this whole KP stuff is. So next, let's touch a little bit more on what actually causes KP or Keratosis Pilaris or whatever. And it's actually, like I said earlier, a genetic condition. That means if you have it, it'll never go away. The things that you could make it better and you could make it worse. So even if you can't see it, you can still have it genetically, even if you can't see it. And that's kind of what the hope is. If you have it as an adolescent or as a teen, hopefully that as you get older, you'll kind of grow out of those stages. It's not contagious. Again, you can't like transfer it from one person to another. And it may have a little bit to do with what you eat. If there's an outbreak, it could have to do a lot with the weather. If the weather is really, really dry, if the weather is like not enough moisture, a lot of times during winter people will get it. That's another really outbreak or set-off of having the KP. So if you already have it, trying to stay moisturized or staying out of really dry winter climates may help you as well. Another cause could be, like I said, the things you eat. Certain people are reactive to certain things, and if you already have an allergy, or if there's just a food that just sets you off in general, you may want to avoid those just to kind of diminish an outbreak. Also, it could be excess oil lining the hair follicle. We have follicles all over our body, and sometimes they get a little bit plugged up. Now, this KP is an excess production of this keratin, but if you have these near the hair follicle, it could be that your hair isn't being lubricated correctly. If that's the case, shaving may help. So those are just some of the causes, and because there is no definite treatment, let's talk about how you can just treat KP so that you don't have to live with it. So what are some of the treatments of KP? KP treatments can be bought like over the counter, or you can go to get a prescription from a dermatologist. If you have this condition, then usually a dermatologist will prescribe you something. There are a lot of medications out there, but the problem is that not all of them really work as well as you'd hope they do. Same with over-the-counter stuff. The main thing to remember is that if it is dry or really, really kind of like a winter season outside, you may want to just try your best to get some moisturizer on there. Something that's really going to penetrate, and maybe even a slight exfoliator. That moisture will probably help calm things down, and if you have something that is a little bit anti-inflammatory, that'll be even better for the itching and the burning if that's what your KP kind of comes along with. Another thing that might help is urea and glycolic acid together in a product. And urea is something that really soothes the skin. Glycolic is something that I actually use for acne, and it's an exfoliator. So the theory is that if you have a product that contains both, the glycolic acid will kind of exfoliate those bumps and try to break down that heavy keratin, which glycolic will do slowly. And then the urea will actually go in and kind of try to smooth things over, and you can even apply a moisturizer on top of that. Now, it's not foolproof, but some people have said that that's worked. Another treatment would actually be shaving the area. If your particular KP is caused by an excess of oil production, sometimes it may be good to exfoliate the area and then shave over it if it's not painful. That will help get rid of the hairs. Now, when the hairs grow back, the KP will probably come back, but it's a quick and easy way that for some people has shown improvement for them. If your KP is extremely itchy and really thick and really red, your doctor may prescribe a steroid cream. These can also be picked up at the pharmacy. And what a steroid cream will do, it's kind of like it'll break down the skin. So it'll help to, if you have really inflamed, angry KP, it'll kind of help calm it down so that the moisturizer can penetrate. Because if your KP is really itchy and kind of all over the place, kind of like eczema, you won't be able to penetrate it with a moisturizer. That's why if you use a steroid cream, it'll help to remove that upper inflammatory part of it so that your medication and your moisturizers can actually penetrate. Also, usually KP is best respondent to repetitive and kind of different treatments. That means that you have to apply your creams and stuff 3 to 5 times a day for the best results. You could wash day and night and apply day and night if you don't have a lot of time, but the more you work on it, the better it will get. Also, if you use combined treatments, such as doing a different kind of steroid cream and peel, using different moisturizers, and really combining a lot of the different things like shaving and applying a moisturizer and things like that, you will probably have better results. So other than ways to treat KP, what exactly are the effects of KP? KP is really just a cosmetic issue. If you look at it, it's not really super pretty, but let me tell you, most people don't notice it. I have not seen a lot of people in my life that have KP. I don't have it myself, but if I look at people, I don't just look at their arms to see if they have it. I don't. So I can honestly say I think I might have known one person in my entire life that has KP, but if it affects 50% of the population, I'm sure I've known people that have it that I just don't know that they have it because I haven't looked. So don't be super self-conscious. I guess you could wear a longer shirt, or you could do some treatments to kind of cover it up, but it's really not that big of a deal. The main thing is that people just worried about it because it's cosmetic. Because it is genetic, there's no health problems concerned with it. You may want to watch your diet a little bit more, you may want to just have a better routine, but it's not like a precursor for diabetes or anything like that. The big problem that takes it from being cosmetic to being a total issue is if it is red and scratchy and peely. Other than the cosmetic stuff, that can actually be painful. So most KP is cosmetic and not very severe, but very severe KP can be very itched and inflamed and rashy and red and peely and flaky and dry. And in that case, that could be a big issue. So you want to try to take a pain reliever. You really want to dedicate a lot of time to applying your moisturizer 5 times a day, washing once in the morning, washing once in the evening, being very careful of what products you use in the shower, being careful of what you eat so you don't outbreak, and just taking a steroid cream so that way, it calms everything down. And really talking to your doctor is going to give you guys the best advice to treat your specific condition, because some is minor and some is severe, and I'm not a doctor, I'm just someone who likes to research things. So I hope you guys found this video informative. I hope this answered some of your questions. If you guys have KP, or if you know someone that has KP, be sure to post in the comments and tell me a little bit more about how you deal with the condition and what has worked for you and what helps you or helps someone you know. And if you don't have it and you're just like me, you don't have it but you have questions, be sure to post those so that we can all kind of get to know what this condition is a little bit better, and really know how to recommend treatment for somebody else, or how to kind of help someone else who, someone else might say, oh my god, I have acne on the back of my arms, or I have these constant goosebumps. They might not even know that they have KP, but it can be treated. So I think that if we all did that, the world would be a little bit better of a place, and people could kind of, actually know what's going on with their bodies. And I hope that you guys enjoyed this. I hope maybe now, if you didn't know that you had KP, you now are able to diagnose it perhaps. But be sure to go see a doctor. So that's all. I love you guys so much. I can't wait to talk to you in the comments, and I'll see you all in the next video. Bye.